In this video, we are going to be talking about the most common dance-related injury by far, the ankle sprain. Hi everyone, I'm Dr. Dwayne Scotti, physical therapist with Spark Physical Therapy, where we help dancers stay on the floor doing what they love without pain, rest, or stopping the activity they love, which is dance. So today's topic is going to be the ankle sprain and how it occurs and how do we diagnose an ankle sprain. So an ankle sprain occurs when you have a specific event, traumatic event, that you roll your ankle out to the side. This typically will occur either landing from a leap, coming out of a turn, or doing point work and being in an excessive releve position. So when the ankle is in releve, it is in what we call a plantar flex position, and this is a loose packed position of the ankle, and it is more susceptible to roll and sprain if the muscles are not strong enough to help stabilize that ankle. So now, if you do suffer an ankle sprain, usually what will occur is you're going to have pain on the outside part of your ankle, you're going to get some swelling that's usually localized to the outside part of the ankle, and it's going to be hard for you to move your ankle. Now, if you cannot put weight on your foot, or you have bony tenderness along the bone on the outside part of the ankle, then the biggest thing that you need to do is to rule out a fracture. So how you do that is by getting a radiograph. So if you're not able to bear weight right after it occurs and you have that bony tenderness, then I definitely want you to get a radiograph to help rule out a fracture. That's actually called the Ottawa ankle rules, and that can occur when you do roll your ankle. So that's first thing is you need to make sure that you didn't fracture your ankle, that it is in fact an ankle sprain. So now, unfortunately, you suffered the most common dance-related injury, the sprained ankle. The last video we had talked about ruling out a fracture as being very, very important. So now you've been diagnosed with an ankle sprain. Now, what does that mean? So the prognosis on how long you need to recover before you get back to full dance is going to be variable. So no two ankle sprains are the same. It's going to depend upon how many ligaments were involved. So there's 3 ligaments on the outside part of your ankle. Did you sprain 2 of them? Did you only sprain 1? Was it a mild ankle sprain, a moderate, grade 1, grade 2, grade 3? There's all these different classifications. So that's first and foremost, is it's going to depend upon how many ligaments were involved, and also if your ankle is restricted in mobility. Sometimes you can sprain your ankle and the fibula bone, the bone on the outside part of your ankle, becomes displaced slightly and subluxed. So now there's a mobility issue as opposed to just overstretching your ligament. All right, so be patient, see your medical provider, make sure you listen to their advice on your recovery. So we already talked about the diagnosis of ankle sprains and ruling out a fracture. So now you have that diagnosis of an ankle sprain, you have some swelling on the outside part of your ankle, and it hurts to walk maybe, and it's hard to move. So what should you be doing during this initial phase, or we'll call this the maximum protection phase. So during this phase, we want to cover the acronym PRICE-MEM. So P stands for protection, R stands for rest, that's active rest, not total bed rest. I stands for ice, C stands for compression, E stands for elevation, and then M stands for manual therapy, so specifically to help decrease swelling and maybe improve a little bit of mobility. And then E stands for early motion, and M stands for medication. So whether anti-inflammatory medications may be indicated during this phase, this would be the time to take them. So our real main goal is to help decrease the swelling, get mobility going in the ankle, some muscle activation exercises, as well as not forgetting about your other muscles in your leg. So when you sprain your ankle, you shouldn't shut it down completely. So this is where I'll work with my dancers on strengthening those turnout muscles, activating those hip muscles, because they are going to be important at helping to prevent a future ankle sprain down the line. So during this initial phase, you might not be able to do a whole lot in terms of exercises for the ankle, but you can actually do a lot of hip as well as knee strengthening exercises during this phase. All right, so remember, this phase will be variable depending upon your type of ankle sprain. Some dancers last in this phase for 1 to 3 days. Others last in this phase for a week or maybe even 10 days. So it's going to be dependent upon you getting a proper diagnosis as well as prognosis on how long it's going to take you to go through these phases. So during this next phase of the rehab, what our main focus is on is starting to improve the strength of the muscles in and around the ankle, which will be essential for proper healing, as well as the other thing that I find that is most commonly overlooked, which is specific manual therapy techniques. Now I'm really talking about manipulation, mobilization techniques to the ankle because of a loss of what we call dorsiflexion, or kind of that flex position of your ankle. So dancers, think about if you're getting some pain with plies, then there are some specific manual therapy, manipulation, mobilization techniques that can be very effective at getting rid of that pain and helping you recover from your ankle sprain. So that is the most common kind of thing that I see in a lot of dancers, is maybe mismanagement during this phase. They didn't get therapy, or they were in an air cast, or they were in a walking boot for 2 weeks, 4 weeks, 6 weeks in some cases, and now they get out of that and they're having a lot of pain and stiffness and they can't flex their ankle. And if they can't flex their ankle, you kind of need some of these manual therapy techniques to kind of get it back to where it needs to be. And then there are some great self-mobilization techniques that you can do on your own, which will help improve the mobility in your ankle. So during the second phase, moderate protection, we're looking to strengthen the muscles in and around the ankles, as well as promote full mobility of the ankle. So this is kind of that last phase of rehab, and the main goal here is to strengthen the ankle and develop neuromuscular control of all of your leg muscles, so from the hip all the way down to the foot. So we need to establish normal movement patterns, and we want you to have the balance, neuromuscular control, and strength to be able to control your leg when you are doing single leg movements in dance, so you can control your ankle when you come out of a turn, when you land from a leap, or when you're going in point. So that is essential at restoring that control. So there's some great kind of what we call neuromuscular exercises, more functional based exercises. Everything that you're going to be doing during this phase is on one leg in a closed chain fashion, meaning your foot's on the ground, so you're not doing any exercises on the table anymore at this point. You really need to kind of progress to function to allow for a safe return to dance. So that is kind of the main exercises at this phase. And then before you do return to dance fully, what is essential is for your body to go through specific plyometric training. And plyometric exercises help reestablish that dynamic neuromuscular control you will need to have your body to be able to control what your ankle is doing in space. So this is where you're going into your jump training. And you're starting with 2 legs, and then you're progressing to 1 leg. You're moving in different planes of movement. You're jumping forward, you're jumping sideways, you're jumping over obstacles. You're doing seesaws, you're doing pas de chats, you're doing specific dance-specific plyometric exercises to allow you to return back to dance safely during this phase. Okay, so this is that last phase of rehab. You should never be going from doing band exercises on the table to being discharged and going right back to your dance class. You need that progressive phase to really kind of reestablish that resiliency in your body to help prevent the next ankle sprain. Because unfortunately, if you suffered an ankle sprain, you're more at risk for developing another ankle sprain down the road. That's why it's important to strengthen your body, get it more resilient to prevent future ankle sprains. Thank you very much for watching this video. I hope this series has been helpful for you. If it has, share it out with a dancer you know. I would greatly appreciate it. Have a great day.